So my name is Tim O'Brien. I'm an endocrinologist at Galway University Hospital. I look after patients with diabetes, and many of them have complications of diabetes. One being diabetic nephropathy, so that's kidney disease associated with diabetes. This is a condition which frequently leads to a requirement for dialysis or transplantation, and often ends in death. So it's a condition that has really unmet medical need. There aren't very good treatments available at the moment.
My name's Professor Matthew Griffin. I'm a kidney specialist and a researcher in immunology at the Regenerative Medicine Institute at NUI Galway. I'm one of the investigators involved in the Nephstrom European Union funded project. The overall goal of our project is to conduct a clinical trial of a stem cell treatment known as mesenchymal stem cells, or MSCs for short, in people who are losing kidney function as a result of type 2 diabetes.
Hi, my name is Steve Elliman. I'm the Chief Scientific Officer at Orbsen Therapeutics. We're a partner in the Nephstrom program. Nephstrom is an EU-funded Horizon 2020 program to look to develop a stromal cell therapy that we've developed called Orbcell as a clinical therapy for patients with diabetic kidney disease.
Diabetes is the commonest cause of kidney disease worldwide. About 30 or 40% of people who suffer from diabetes will develop kidney disease, and a large proportion of those people will go on to lose kidney function and require a renal replacement therapy like dialysis or kidney transplantation. In people with diabetes, kidney disease is also a marker for high risk of death from cardiovascular complications. So there's a tremendous need for new treatments that would prevent or slow the progression of kidney disease in people with diabetes. Most of the people in the world with diabetes have type 2 diabetes, which is associated with abnormal inflammation and damage to many organs of the body, including the kidneys.
So I had a project funded by the EU called Red Star, and in Red Star we did some work in animal models of diabetic kidney disease, and we saw that there were some very beneficial effects of a stem cell population which are isolated from bone marrow and grown in a special facility called a GMP facility. So on the basis of the very encouraging results seen in the animal work, we applied to the EU and were funded to do a clinical trial.
So Nephstrom is a rather remarkable EU program that pulls together 4 clinical trial sites around Europe, in Birmingham, Belfast, Galway, and in Italy, and Bergamo. And there's 4 manufacturing sites that will be manufacturing our cell therapy product in Leiden, here in Galway, Birmingham, and again in Italy. So what we've done here at Orbsen is we've developed a stromal cell therapy. Stromal cells are cells that reside in the vasculature, in your blood vessels. They actually surround your blood vessels. And what they do is they control the ability of immune cells, inflammatory cells, to move out of the bloodstream and into tissue to cause either resolve infection or resolve damage. But in critical and chronic disease situations, those inflammatory cells can enter tissues and cause damage. And one of the things that causes damage in diabetic kidney disease is inflammation.
A key strategy for this part of the Nephstrom project will be to examine the effects of MSCs on pathways of inflammation that are known to be important for the onset and progression of diabetic kidney disease. This is particularly germane to the role of MSCs in treating kidney disease in people with diabetes, because it is known that MSCs have a strong capacity to suppress and modulate damaging immune-mediated and inflammatory responses.
So we're going to enroll patients who have diabetic kidney disease, which is progressing in spite of current therapies, and which is likely without any intervention to end up with end-stage kidney disease, and we're going to test this stem cell therapy. It will involve one single intravenous injection of stem cells, and we will do it in a manner which will be dose escalation in nature. So we'll test 3 separate doses of the stem cells, and at the end of each dose we'll determine safety and we'll look for any evidence of efficacy. So we'll ask, in essence, is this dose of stem cells safe and effective?
So we've managed to isolate these stromal cells using a proprietary technology, an antibody called OrbCell, and we use the OrbCell technology to purify these cells. Now, historically, stromal cells have been isolated using a very old-fashioned method developed in the 60s, where all we do is we take tissue, like bone marrow, fat or cartilage, and we just put it down on a dish. The stromal cells stick to that plastic and they grow. And those cells essentially expand and grow, and they're the cells that historically have been injected into patients with kind of varying effects. What we've managed to do is, at Orbsen, is isolate the cells specifically. So typically in your bone marrow, maybe 1 in 50,000 of your cells is the stromal cells. Using our technology, our antibody technology, we can purify the cells to about 1 in 2. So almost every cell that we isolate is a stromal cell. And we've seen that in other programs that we have running with the EU, that purification process leads to better outcomes, better efficacy in models of disease. So we've tested this in models of diabetic kidney disease, diabetic wound healing, diabetic pain, retinopathy. We've looked in settings of inflammatory liver disease and also in acute lung injury models like ARDS, acute respiratory distress syndrome. So we're really excited about the implementation of OrbCell, where we think it's a much better product. It's better defined from a regulatory standpoint because it's much better defined than other products. The regulators are very keen to see that in cell therapy, that we understand exactly what the cell is. So we're excited to be a part of the Nephstrom project. We're excited to be part of this pan-European trial to assess a novel stromal cell therapy in diabetic kidney disease patients, and we're confident that we'll get really interesting data that will lead to patients with diabetic kidney disease being prevented from going on to dialysis and maybe even delay the need for dialysis altogether or for kidney transplantation.